I think the diversity of it. I get bored very quickly, so I look for different challenges and different things to do, and I think that this kind of work really offers that to you. And one of the best things is that it gets you away from Medicare. I think that we need to stop thinking that we need to get paid by Medicare for everything that we are doing, and this really is a good job for getting you away from that. The other thing is also sort of like that's more probably for my satisfaction is it's a very artistic work, and to do good fillers or injectables in people, and then seeing the satisfaction that they get from that is quite rewarding. And your patients really go away feeling good about themselves as well. If I think as an example with acne, children, one of the biggest things that, they're at a very sensitive puberty age as well, and then you make a difference for them and an improvement, and then to see the level of their confidence. And even women, where they've got considerable solar damage because of the area where I work. It's a lot of farming community out there, and to see the improvement in their skins as well, because we've got such a harsh climate, and there's a lot of job satisfaction in that when you see how happy your patients are when they walk away. I think one of the biggest things is that if you go into this kind of work is that you really do need to look at the demographics of your area. You need to know what it is that people would want, and also what the cost of treatments are, whether it's affordable to them, whether there's a requirement for it. I think one of the worst things that you can do is to actually purchase a piece of equipment and then you try and find the clientele for it. It's much better to look at your demographics of your area and then, see that there's already a need for that type of treatments, and then purchase the equipment accordingly. And often it's got a sort of a flow-on effect. Once you start with one type of treatment because there's a need for it, something else, you start identifying a need for something else, and that's how you then gradually build on those treatments. That's what I would advise people to do, and look, because I think you make less mistakes that way.